evening and welcome to Healthline. I'm Suzanne Whatley.
Good evening, and I am Gregory Zarian.
You know, our community is getting older, and so is America as a whole. In fact, our average lifespan is now just shy of 80 years old. And here in the Glendale community, according to the 2010 census data, the median age is 41 as of 2010. 10 years before that, it was a little over 37 years old. 10 years before that, it was a little over 33 years old. So we are, as a community, getting a little bit older every year.
Well, that's also because we live more of a productive lifestyle. You know, health, wellness, and also there's a great study that if you actually mentally think that you're healthy and well, you're going to be healthier and well. And of course, I'm all about copy and pasting, nipping and tucking, and Botox and fillers.
No, we're going to do it naturally, right?
Dang it. It doesn't hurt to throw it out there, though. You got to support the ones you love.
We are talking about aging gracefully here on Healthline tonight, and it's a pleasure to welcome our first guest, Dr. Jack Yu. He is a physician specializing in geriatric medicine and has a practice here in Glendale, and he also teaches at Glendale Adventist Medical Center, medical students and residents there. Thank you so much for being here.
My pleasure.
Dr. Yu, tell us pretty much what drew you to a geriatric specialty.
Well, I saw my parents were getting older, and I realized that all of Americans were getting older, and the older population was getting larger. There seemed to be a great need.
So then what do you find fascinating about the challenge of people getting older then?
Well, older people are in general more sick, and there's more things we can do to help them to stay better and to get better.
And are they receptive to it when you counsel them about how to live healthier lives?
Yes, in general they are.
So they're not like me, they don't kick and scream and say, I don't want to get old, and they have the Peter Pan syndrome.
Well, some of them are like that, but most of them try to work with the program.
Okay, so they go with the flow?
Yes.
And what do you find so fascinating and challenging about dealing with elderly?
Well, most elderly people have a lot of problems. For example, half of all people that age have high blood pressure or arthritis. A third will have heart disease. Many of them will have diabetes and emphysema as well. So a typical patient I have will have at least 5 to 10 medical problems or diseases.
And we're going to continue our conversation with Dr. Yu and also bring on a couple of local seniors with their inspiring stories as we continue with the topic here on Healthline.
Hello, I'm Dr. Jack Yu. I work at Glendale Adventist Medical Center. I'm here to give you a health tip on aging gracefully. The American population is getting older, and there are more of us that are getting older. So in order to live gracefully, we need to do a few things. Exercise, keep active. Nutrition, eat right, don't be overweight, eat the right things. And being a nice person, working with your family, having a purpose in life, being in your faith community. This is Dr. Jack Yu, a health tip from Glendale Adventist Medical Center.
Hi, are you a member of Facebook? You know, I am, because I like to know all that my friends and family are doing. Wait, did you know that Healthline has its very own Facebook page? All you got to do is go to Facebook, type in Healthline, find us, click like, and become part of the conversation about health, lifestyle, and the community. We post links, health tips, suggestions from you, the community, about what you do to lose weight, de-stress, have a happy, healthy lifestyle. Okay, once again, all you gotta do is go to Facebook, type in Healthline, and become part of the conversation. Hold on. Okay, somebody just posted that if you drink an 8-ounce glass of warm water with lemon, it starts to invigorate your metabolism. Oh, along with jumping up and down for 60 seconds first thing in the morning. Okay, you know what? I've got to pass this on. Become part of the Healthline conversation. We will see you on Facebook. Welcome back to Healthline. Tonight we are talking about aging gracefully. That just seems so hard to say out loud. And can I get any help at all? No?
Well, we're getting younger every day.
Okay, we're getting younger,
different.
But by spirit. We're joined by Dr. Jack Yu, a specialist in geriatric medicine. Welcome, Dr. Yu.
Thank you.
Why is there a shortage of specialists in your field?
Unfortunately, it's an American problem of money. Geriatricians take care of very sick patients, many different problems. It's not that easy. And they don't make any more money than most normal doctors. And you have your surgeons, your cardiologists, and they make a lot more money. So medical students tend to go where their heart is or where their wallet is.
Well, the beautiful part of that, though, is you said you were inspired by actually watching your parents age.
Correct.
That's beautiful.
And so you were initially a family medicine specialist, and then you went into geriatrics?
Yes, I branched off and subspecialized in geriatrics.
And was that when you were at UCLA?
No, it was after UCLA, but yes, during that same period of time.
So it's called aging gracefully. Doctor, why do people slow down? I mean, I know we get older, but why do we slow down?
Well, I'd like to tell you a story about my mother. My mother says, you know, I'm getting older, I need to not to do all these things, I cook and go out in the garden. But that's not really true. It's just that she thinks she needs to go slower. But actually, if we keep active, we can continue to do many of the things we used to do. However, you know, about half of all Americans that age have high blood pressure or arthritis. Medicines for high blood pressure can make you tired, can make you slow down, and so can arthritis.
So there are physical reasons, but then there's also cultural influences as well, where we just sort of think, well, now that we're older, we can kick back, we can relax, we can let the kids do that for us.
Sure, and that's a big mistake.
I take inspiration from my 93-year-old grandmother. She was 93 when she passed away, but she was up in the morning with the sun, and she was cooking, and then she'd put on her bonnet and get out there with the choppers and chop ivy, and that's why she lived such a long and healthy life, I think.
And my grandfather was on his bike until the age of 83. So,
wow.
but why do you feel that then we as a society, you know, assist people that are older and go along with the conversation about, oh, you know what, you must be a little older, so you're tired, so sit down, don't do as much. Why do you feel that we're so much a part of the conversation?
Well, it's hard to say, but in Los Angeles, we're in Hollywood, we're a youth-oriented culture. And so when we think about older people, we think about, oh, wheelchairs, nursing homes, things like that. And that's really not true.
Talk about the physiological effect of aging. I mean, when we become sort of more sedentary and less active, what is that signaling to our body?
It's really hard to say. There's a lot of speculation on this. But in general, if you are not active, then you are not producing certain signals to your body. And there's a theory that cytokines may be part of that. So by staying active, you keep your muscles moving, you keep your joints moving, and you are more active. Just think of it this way. If you were to keep your arm in a cast for 4 weeks, when you took it out, you would not be able to move your arm. And that's similarly with your body.
So what do you recommend in terms of physical activity as we get older, and maybe as you in certain age groups?
Well, it depends upon what you have in terms of diseases and your mobility. But walking, almost everyone can do. So that's a good place to start. If you can do something that you like, that's really important. If you can do it with someone you like a group, a walking club, a running club, a bike club, a swimming club, that'll keep you going as well.
So become part of an exercise community.
Correct.
Doctor, what are you saying in regards to time and how far?
Well, some of the books say that the more you do, the better. So optimally, if you could do, for example, active exercise, pretty vigorous, 6 times a week, an hour, that would be optimal. At minimum, do 20 to 30 minutes every day.
We were shared once with, for 150 minutes every week for just some great exercise.
Great.
True.
And the impact exercise really helps strengthen the bones, I understand.
It does. It helps you to treat osteoporosis or prevent osteoporosis.
Mm-hmm. And that's something that naturally occurs particularly in women as we age?
It happens in both men and women first and men 10 years later. And that's because of the loss of our hormones. Like
I don't know if you noticed this, but you said women as we age. You're like during the women's, I was like, okay, you speak for your people, I'm going to go for us guys. So do you believe that getting older is more an affair of the mind as well? Because bottom line is, yes, our bodies do get older.
That's correct.
But our minds, they're very much part of how active we need to be, yes?
So we need to separate disease, like arthritis, heart disease, from normal aging. And normal aging doesn't have to be that bad. And if our mind stays active and we are committed to staying active, we're more likely to keep going and have a more graceful aging process.
Up next, we're going to explore more in depth the aspect of mentally aging. And, you know, a lot of people are afraid of Alzheimer's and dementia. What are your risk factors? How likely are you to get it? Stay with us. We're here at Glendale Adventist Medical Center to find out about the hospital's new program for people 55 and older. Joining us is the director of the Live Well Senior Program, Denise Miller. Thank you, Denise.
Thanks, Suzanne.
Tell us about the program.
Well, the Live Well program at Glendale Adventist is a program that we have created specifically dedicated to the 55-plus population and helping them navigate through the maze of the healthcare system, both within the hospital and out in the community.
Tell us about the services and benefits that are offered.
The Live Well program is a membership program. It's actually a two-tiered program. It includes one that has benefits where you can pay an annual fee. It includes things like free notary for health-related services. You can meet with a pharmacist. A lot of value-added things that come with a cost. It's a very nominal fee. Our Live Well program, our regular program where there's no charge, includes some great discounts within the hospital systems and other service and departments that work with seniors. For example, you can get great discounts in our gift shop and in our cafeteria. And at our Therapy and Wellness Center, we've had a long-running and very active senior exercise program.
And how do people get more information?
There are a couple of ways. They can go on the website, glendaleadventist.com/livewell. They can also sign up online.
Consultations, discounts, help with billing and prescription medications, even a lounge. It's all part of the Live Well Senior Program here at Glendale Adventist Medical Center. We're talking about aging gracefully here on Healthline tonight, and a focus in this segment will be on our mental well-being. A lot of people are concerned about Alzheimer's and dementia. It's cruel diseases that rob us of our minds before our bodies are ready to let go, and creating a lot of stress on caregivers as well. And then there's the topic of depression, which elderly folks are often prone to. Dr. Yu, a specialist in geriatric medicine, what do you see in your patients in terms of depression?
Well, we do know that elderly people or people over 65 are more likely to have depression. I'm not quite sure about the reasons, but some of the possible reasons are that as we age, unfortunately, women live longer than men. As a result, there are many more widows. So losing a spouse, having a change in your family situation can lead to isolation and separation.
But doctor, do you feel that depression pops in also because of lack of purpose? And because we, as people get older, that they don't think they have as much to do when they fall into the category of, oh, I'm older, I can't do this. So they mentally just get stuck on their own.
Are they retired?
Well, that does happen. So men especially, we like them to have a plan after retirement. Women seem to be much better, and they seem to be able to find things to do, get purpose in their life, and they have friends and community to rely on.
What are the signs of depression?
Well, there are many signs. There are about 10 of them that we actually look at. But the most important sign is sadness. Are you sad? Besides that, you may have problems sleeping, have less energy, have difficulty with your memory, as well as just not having a sense of wellness, feeling guilty, things like that.
So then even to the point when you just said sad, so then do you suggest to people that are dealing with parents or loved ones that are of the age of 65 and seem like they're depressed, bullet question is, are you sad? Talk to me. Share it with me.
That's the one question you should ask.
Is treatment of depression in the elderly different than in younger people?
Not really. The two ways we treat depression is one is talk therapy and one is medication, and actually the best is a combination of both.
And so when you say talk therapy and medication, is it also inviting activity as well? Because bottom line is, if you're isolated, you get so stuck, no one's there to help you. But if you actually get the courage to reach out or have someone reach out to you, you then start creating this bigger world, as you were saying, with talk and invite activity and do more than that, right?
That's correct.
Okay.
And what do you suggest to your patients who are depressed in the talk portion of the therapy?
Well, a lot of it is going things like, are you exercising? What is the problem with your depression? What started it? The medications deal with the chemical changes in your brain when you're sad for a long period of time, but it doesn't address why are you sad. So you have to get to the root problem, why you're sad, and what you can do about it.
I love that.
And how do you suggest to your patients keeping mentally sharp?
Use it or lose it.
Oh, can you say that again?
Use it or lose it.
Do you hear us out there?
That's
Use it
great advice.
or lose it. Thank you.
So if somebody doesn't perhaps fancy crossword puzzles, what else do you recommend?
So some of the things that are recommended are, for example, learning a new language, a new instrument.
Oh, that's great.
Music, perhaps a new skill, taking classes at a college or other place.
I remember my dad retired from his law practice, and he was in his early 80s, and he decided, I'm going to take an acting class at Pasadena City College.
Great.
And he loved it, and he got an agent, and he got some acting jobs.
You got to love those actors. Shameless lot.
Let's talk about Alzheimer's and dementia. What's the difference?
Dementia is a larger group. Dementia has at least two major types of dementia, Alzheimer's and dementia from strokes. And there are other ones that are less common.
What's the likelihood that either of us would get Alzheimer's?
Well, at a young age, not very high, but about 10% at 65. And if you live to 85, about 40% of people have dementia.
Is it hereditary?
Not necessarily. So there is a test you can do to see if you carry the gene, but only about half of those people actually will get Alzheimer's.
And is there a treatment?
There is treatment. Not a cure, but there is treatment. There are medicines you can take. There are things you can do.
And back to what you said, use it or lose it.
Coming up, we're going to be talking to two members of the Live Well community here in Glendale. Stay with us.
I'm Helen Ossendorf, and I'm 92 years old, and I recently had a stroke. I had the new medicine that they used. It was not used on anybody my age, and my son convinced them that I was active and that I could do it. So they gave it to me, and 2 days after it was over, I got my speech back, and I was active in the hospital, and the people just couldn't believe it. Now I'm fine. I'm doing everything I did before. I drive the car, I'm active in my church, and I have PEO, which is a women's organization, very active in that. I feel very, very blessed. And to have a doctor like Dr. Lee and to have the care that I got in Adventist Hospital is just, there's no way to thank everybody. Whatever it is that you're worried about, the nurses, the staff in the hospital, just express your feelings. Tell them how you feel. And they're all there to help you. Everybody in that whole hospital is just here to help.
Here on Healthline, talking about aging gracefully, we welcome two members of the Glendale senior community, Bob DeWeese and Beth Peterson. Thank you very much for being here.
Hi, kids.
My pleasure.
And they're
How are
joining
you?
Dr. Jack Yu, our specialist in geriatric medicine. Both of you volunteer at Glendale Adventist Medical Center. Is that how you heard about the Live Well program?
Yes.
What
Yes.
attracted you to it?
Well, the activities that I think they're going to provide. I'm looking forward to the lectures that are supposed to come out every month on different subjects. I find that very interesting.
Then how did you hear about it?
Well, I'm a member of the Guild Board also. That's where I first heard about it. And I'm looking forward to being able to share it with friends also.
And you've actually known me because I went to school with your son, and
Yes.
we graduated in 1993.
What?
Oh yeah, don't tell a lie, I'm 36. Gary, it only behooves you to say yes. Have either of you noticed, in regards to what we were talking about earlier, depression and feeling like you're slowing down, have either of you suffered from that as you've been aging? Not at all. You know.
I'm too busy.
You are too busy. I can attest to that. You know. What
Well,
about you,
I stay busy on purpose, but I feel it. I do my own yard work, and if I'm mowing the yard, I don't do the backyard and the front yard at the same time. I take a break.
But do you find, though, if you allowed yourself to then get sedentary, would you? And do you find doing more physical activity is a lot more of a chore, as per choice?
I've learned to pace myself.
Okay.
Yeah.
I used to do that, but now I pace myself.
Yeah, I think you do pace yourself more as you age, but yeah, I don't want to get real sedentary, and
So you don't allow that to sink in.
don't like that happen.
So you choose to be up and active.
Right. I'm a professional volunteer.
But I love that, though.
Yeah.
And Beth, at age 78, runs marathons. Tell us about that.
Well, it's just a lot of fun to do.
Are you the full marathon or half marathons?
Well, I've
or-
done many halves. I never kept track, but I've done 48 full marathons.
Seriously?
Yes.
That's right, I was with you behind all of them. I let you win. We're not going to discuss, that's a whole different show about letting Gary's mom win, but that's fine.
Have you always been a runner?
No, I didn't even know what a marathon was when the LA Marathon started.
So
I
then
did
what,
my first one when I was 56.
what inspired you to do a marathon?
Well, I heard about a clinic that was being started at Verdugo Park, and I thought, oh, that sounds interesting. I probably should do that, you know. I found out real fast that there was a lot of work involved.
So then, Dr. Yu, you see that both of them are extremely active.
Yes.
Is it normal for people in their 70s to be this active, or are they exceptions to the rule?
Well, I think running marathons is probably an exception, but staying active is a good part of the majority of Americans. And then, unfortunately, there are the other minority Americans who are not so active, and they need to get more active.
So then how do you inspire them to be like these two amazing individuals?
Well, I wish I knew, but maybe the Living Well program is part of it. Senior centers are part of that.
And
Great
do you find
wraparound.
volunteering is part of your staying young?
Oh, yeah.
I like to be involved, and if I wasn't volunteering, I'd feel like, since I don't work anymore, I wouldn't be involved in anything. I like to be involved, be with people, do things, travel the world.
And you like to be part of it, the purpose.
Pardon me?
And you like to be part of the purpose,
Right.
being with other
Have a
people.
purpose.
I go on mission projects too around the world.
That's fantastic. Don't go away. We will give you final thoughts on aging gracefully. And of course, you've noticed I've quit kicking and screaming. Hi, are you a member of Facebook? You know, I am, because I like to know all that my friends and family are doing. Wait, did you know that Healthline has its very own Facebook page? All you got to do is go to Facebook, type in Healthline, find us, click like, and become part of the conversation about health, lifestyle, and the community. We post links, health tips, suggestions from you, the community, about what you do to lose weight, de-stress, have a happy, healthy lifestyle. Okay, once again, all you gotta do is go to Facebook, type in Healthline, and become part of the conversation. Hold on. Okay, somebody just posted that if you drink an 8-ounce glass of warm water with lemon, it starts to invigorate your metabolism, along with jumping up and down for 60 seconds first thing in the morning. Okay, you know what? I've got to pass this on. Become part of the Healthline conversation. We will see you on Facebook.
Now some final thoughts here on Healthline on being the best golden oldie that you can possibly be.
She had to say that. Okay, go ahead.
Beth and Bob, what are your top 3 tips for staying sharp?
Keep the mind active. I work crossword puzzles, Sudoku, various things like that.
I love to read. I read every minute I get. I take 3 newspapers, try to read the Runner's World and everything I can get my hands on. And then, of course, I'm always out there putting the miles in. And volunteering is once a week, and I just keep really busy.
I love that.
Dr. Yu, your professional opinion on the top 3 things people can do to stay sharp.
Sure. Exercise, nutrition, and commitment. Exercise, keep moving. Nutrition, less fat, less calories, less meat, more plants. Commitment to faith, friends, and family. And be a friendly person.
Speaking of family, what can children do to help their aging parents the most?
Well, I think you need to keep them active, make sure that they're in a community of some sort, take them to the doctor when it's appropriate, and make sure they follow up with what they're supposed to be doing.
But then also go back to what you said previously is, if your parent or someone you love seems depressed, ask them, are you sad? And then also that's where you invite the person you're asking to actually be honest and say, I'm sad because of. And also get involved, because you're very connected to your son.
Yes.
So stay connected to your family.
I have 4 children, 10 grandkids, and 7 great-grandkids.
Wow. No wonder you run. You're running from them.
I'm running from them, yeah.
The internet's a great way to stay connected. I have a son in Tokyo, and so we Skype and have video calls, which is really wonderful to be able to stay connected with him and his family.
And you travel a bit?
I just got back from Japan and visiting the family there. Yeah, I enjoy travel.
Kids, it was an absolute pleasure to have you. Thank you, Dr. Yu.
Sure.
So you heard it from our kids on set. Stay active, keep this going, and the only thing that's going to get in the way is you. So on behalf of myself and my lovely co-host, We'd like to thank you for joining us. A big shout out to My Secret Garden for these amazing flowers. Go to mysecretgardenla.com, and remember, the most important conversation you're going to have is a conversation about your health and wellness. So why not have a young, fun, and inspiring one? We will catch you next time.
Set a goal, stick with it. Good night.